What if I told you most autoimmune symptoms can vanish in just 8 weeks without a single pill? Well, here's exactly what to track to know if carnivore is actually working for you. Hi, everybody. My name's Marc Bates. I'm a metabolic health coach, and this is part of my question and answer series Autoimmune Reversal with Carnivore, What to Track and When to Expect Results. Okay, real quick here. If you have an autoimmune disease, please make sure that you talk with your doctor before you make any changes and you do this and work with them on implementing carnivore to help reverse your autoimmune disease. Okay? Uh, I'm not a doctor. I'm not prescribing anything. I'm just telling you what we can find in the literature. Okay, here's the question. You mentioned tracking symptoms and looking for flares during the therapeutic phase. What specific biomarkers or symptoms should someone monitor to determine if the carnivore intervention is actually working for their autoimmune condition? And how long does it typically take to see meaningful changes? Well, that's a big question, okay? When using a carnivore diet as a therapeutic intervention for autoimmune conditions, tracking both subjective symptoms and objective biomarkers is essential for assessing progress and guiding decisions about reintroduction or continuation. So here's a comprehensive breakdown. So what to monitor? You want to start with some clinical biomarkers, and we'll talk about those, right? Then there are comprehensive monitoring items that you want to make sure you're doing, right? There are symptom tracking, right, which are not lab work, but it's what you're feeling. And then talk with your doctor in terms of guiding decisions on how you're monitoring, how you're progressing, and what you do next with that, okay? So let's look into these. So phase 1, what to monitor? Well, there are a bunch of clinical inflammation markers you're looking for. A lot of them are in the category of inflammation, as you can see. But for inflammation, you typically want to look at the hs-CRP, right? That's the highly reactive, highly sensitive CRP test. ESR, which is also called the SED rate, and you want these to be going down. And ferritin, which is in your blood. And if elevated from inflammation, you want that to be going down. As far as immune activity, you want to look at biomarkers ANA, RF, anti-CCP, and TPO, right? These are antibody titers or stabilization. You want them to be going down. Once again, your doctor can help you pick the right tests to choose, or if you're comfortable, you can run your own blood test in almost every state. There are ways of doing that, but work with your doctor. Make sure you're knowing what you're looking for here, okay? For gut health, what you're looking for is a test for zonulin and LPS antibodies, and these are markers of leaky gut. And once again, you want this to be going down. It's an optional test, but I find most people with autoimmune disease probably have leaky gut as well, okay? For your liver and kidney function, you want to look at ALT, AST, GGT, creatine, and BUN. You want these stable or improving. You want them going up. You want these values to be good, okay? Once again, work with your doctor on that. And metabolic ones, you want to look at your insulin levels, your HOMA-IR, and A1C. These should be normalizing or reducing depending upon where you're at, okay? And then for thyroid function, look at your TSH, free T3 and T4, and TPO-AB. So once again, you're looking for these to normalize or reduce antibodies. Okay, so and you don't need to test everything monthly, but establishing a baseline and checking every 8 to 12 weeks is probably a good idea. Okay, all right. Symptom tracking. So these are the symptoms you might be looking at, and once again, what you want to do is keep a journal and make sure you're tracking this, because a lot of times the symptoms you'll start seeing notice, but they're smaller in terms of movement. And if you don't have test results to back them up, you may forget about them. So do track this, okay? Pain and inflammation, especially joint pain, swelling, and morning stiffness. Skin irritations, rashes, eczema, psoriasis, things like that. What's your energy feel like? Do you feel fatigued? Do you have more stamina? Brain fog? What's your mood? Is your mood getting better? Digestive health, right? Are you bloating? Gas? Is stool quality good, right? keep track of that. For women, obviously, and you're in the appropriate age group, menstrual cycle, right? Are you cramping, regularity? Do you have PCOS symptoms? And other autoimmune functions, Raynaud's, MS flares, lupus symptoms, etc. Use a scale, 1 to 5. This is a real quick, easy test. Yes, no, flare, improved, right? So, and for each, patterns over time are what matter, okay? And what you're looking for is a long-term trend. Okay. Phase 2, timeline of expected improvements. Once again, these are for average people. These are not for you as an individual, so things will be different. Week 1 to 2, initial adaptation, energy swings, electrolyte loss, improved satiety, decreased bloating. This is just pretty normal when you go on the carnivore diet. Week 3 to 6, we normally see a lot of people with reduced joint pain. Even if you don't have autoimmune conditions, a lot of people have arthritis and stuff, which is maybe considered an autoimmune condition in many ways. Okay, so you'll see that clearer skin, better sleep, reduced GI symptoms. In the 6 to 12 week period, you should see lower inflammatory markers, reduced flares, improved mood, and cognitive clarity. In that 3 to 6 month range, see decreased autoimmune antibody, right, titers, sustained remission, and reintroduction of testing is possible. Though once again, depending on where you're at, you may want to just keep going completely carnivore. Once you get used to feeling well on carnivore, it's hard to go back, okay? And then in the 6 to 12 month period, you want to see continued remission or reversal. Your Hashimoto, psoriasis, and IBD should be going down, okay? Now, big note, some people will improve within 3 to 4 weeks. But for many, full autoimmune resolution often requires 8 to 24 weeks, maybe even more, especially for systematic conditions like lupus, rheumatoid arthritis, or MS. And you may never get 100% remission, right? I mean, just understand. That's the nature of these type of diseases. And also remember that certain things, like for example, if you were eating a standard American diet, lots of processed foods, lots of seed oils, well, those seed oils, the linoleic acid in seed oils, will have a half-life of about 600 days. So that means that they're going to stay in your cell walls if they're embedded in your cell walls for several years. So it may take time. So don't expect this is an immediate improvement, but you should see enough improvement pretty early on that you're encouraged. And that's the whole idea, is slow, incremental, good progress, right? Okay, lab cheat sheet. Right? If you have Hashimoto's, TSH, free T3, free T4, TPO, and stuff. For rheumatoid arthritis, RF, anti-CCP, ESR, hs-CRP. For psoriasis and eczema, hs-CRP, stool, and zonulin testing. For lupus SLE, ANA panel, ESR, complement levels. Excuse me. And for IBD, right, Crohn's, you see, for example, calprotectin, CRP, LPS symptom log. Excuse me. Go ahead and work with your doctor on these tests once again. It's best to have somebody you trust helping you look these over. Okay? When you know it's working, you'll have fewer or no symptom flares, right? For example, I haven't had joint pain in 3 weeks. Reduced or normalized antibody levels, improved mood, skin, sleep, energy, and digestion. No need for medications or dosage reduction. Do not reduce your medications without your doctor involved, okay? And long periods of symptom-free living. But here's what happens. You go on carnivore and you start healing. And there are hundreds and hundreds and hundreds of people who have their personal stories of healing autoimmunity, right, going on carnivore. Work with your doctor. Make sure that the long-term stuff is being taken care of and that it's being monitored. But a lot of stuff you'll feel are stuff that you don't necessarily are taking medication for. They're just symptoms, joint pains and stuff. And so in your mood and energy levels. And these go up. And that's when you know it's starting to work, okay? So there's a lot of good news there. When to be cautious. If you're not seeing improvement after 90 days of carnivore, reconsider your triggers. Are you eating dairy and eggs? If you are, let's go completely carnivore here. and get rid of the dairy and eggs. Weight loss is too rapid. This does happen because what happens is you get so satiated with carnivore diets, you don't eat enough. You almost have to force yourself to eat sometimes, right? Um, you don't want to lose weight too rapidly. I know that's seems kind of odd, but you don't want to lose weight too rapidly. So do watch that. If you are losing weight too rapidly, increase your meal intake. If you're eating one meal a day, go to two. Increase the amount of fat you're taking in, because that's the energy. You don't want it to be utilizing your body fat too much, because you're literally starving yourself if you're not eating enough, right? Your labs start worsening, right? Your thyroid tests, your electrolytes, your fasting insulin. Well, that's a problem, and work with your doctor on that one, right? Because it could be something else in terms of how you process proteins and fats. You may have some issues in terms of not having enough acid in your stomach. Your acidity is low. You may need to worry about how you're digesting fats, right? Look into that. And reintroductions cause flares. So let's say you go full carnivore, no dairy, no eggs, and then you reintroduce eggs, and things pop up immediately. Well, that tells you something, right? So so a strict elimination diet may be the goal there. Okay, so thanks for watching, everyone. If you have comments and questions, please leave them in the appropriate section and let me know what you're thinking. If there's something you want me to cover specifically, put it in the comments. I'm here to help you. This is a community, and I want to give you the answers you want. If you haven't done so, please like, subscribe, share this with somebody who may need it, right? And as always, your doctor is your friend. Your doctor is our partner in your health. But they may not understand the carnivore diet very well, so make sure they know what you're doing. All right? Thank you very much.